Welcome to Physiomobility's Total Hip Replacement Exercise Program for weeks 4 to 6. For the warm-up section, please repeat each movement up to 5 times before proceeding to the exercise section. For the first movement, take a deep breath as you reach your hands up towards the ceiling. If you can't go all the way overhead, just reach as much as you can up towards the ceiling and back down. You want to take a deep breath while opening up the chest and the arms. For this next movement, you want to squeeze your glutes while pushing your heels down into the ground as much as possible. When you squeeze your glutes, hold for a few seconds and then relax. Now we're moving on to the exercise portion of this program. For this exercise, you're going to firmly grip the towel behind the thigh of the operated leg. From there, you're going to slowly slide the heel out as much as possible and then use the towel to bend the knee back in towards the body and repeat this movement. For this next movement, starting with both legs bent at 90 degrees, you're going to slowly bend the operated leg down towards the ground, away from the body, and then back towards your midline. You want to repeat this movement nice and slowly. In this movement, you're squeezing your core to push your back down into the bed. From there, you're going to squeeze your glutes, push through the heels, and slightly lift off the ground. You only want to go as high as you can and then gently relax. This movement, we are repeating the previous exercise, except this time we're placing a small ball in between the legs. While you have the ball in between your knees, you're going to squeeze your knees together as you push your hips off the ground and relax back down. For this exercise, keep the operated leg as straight as possible. From there, you're going to flex your foot towards the ceiling and lift the leg up towards the same height as your opposite knee and relax back down. For this one, you want the movement to be coming from the hip and slow and controlled. This exercise, place a towel in between the heels. From there, you're going to squeeze your heels together as much as possible while keeping your knees bent. For this next movement, squeeze the glutes and push the hips down in towards the bed. From there, while keeping a straight leg, you're going to lift your heel and your leg up towards the ceiling gently and relax back down. Only lift as far as you can go with just squeezing the glute and keeping the leg straight. For this next movement, place a strap around the ankle of the operated leg. Using your hands, you're going to gently pull at the strap to bend your knee and bring your ankle towards your glutes. From there, you're going to gently let the strap release as your foot returns back down to the bed. You're going to repeat this motion to increase knee flexion in a gentle and controlled manner. For this next movement, place a strap underneath your foot, lean slightly forward, and keep your leg completely straight. From there, you want to lift your leg off the ground while moving your torso slightly back and forth and keeping the back completely straight. This next movement, place the operated leg closest to the wall. You're going to slowly and controlled lift your leg up onto a step and control it back down. For this next exercise, have your back facing the wall. From here, you're going to bring your operated leg up to the side onto the step and control it back down. For this exercise, we are only working the operated leg. Place a resistance band around the ankles, gently move your leg out to the side against the band, and relax back into midline. Similar to the last movement, place a resistance band around the ankles, except this time we're going to gently lift the leg backwards, leading with the heel, keeping the leg completely straight, and relax back to midline. For the sit to stand, place your operated leg slightly in front of you. If you need to, use the chair handles to push yourself up and relax back down. You want to make sure that you're taking your time through this movement and it's slow and controlled. For the squat movement, you want to make sure that you're leading with your hips by pushing back and then slightly bend the knees. It's important to place your weight on the heels of your feet and then stand back up to resting position. For this next movement, Bend down into a quarter squat position, pushing your knees against the band to the outside and relax back in. For the final exercise, sit in an upright position, using your legs to bike forward and backwards to build strength. Once you've completed each exercise 10 times, repeat this routine one more time and please talk to your therapist if any new problems arise.